Retinoblastoma is a rare but serious type of eye cancer that primarily affects young children, typically under the age of 5. It's a condition that develops in the retina, which is the light-sensitive tissue at the back of the eye responsible for detecting light and color. This retina is like a camera film that lines the back of the eye. It's made up of specialized cells called photoreceptors that capture light and convert it into electrical signals. These signals are then sent to the brain through the optic nerve, allowing us to see. Retinoblastoma occurs when the cells that are supposed to develop into these photoreceptors instead become cancerous and multiply out of control, forming a tumor that can potentially spread to other parts of the eye and even to other areas of the body if left untreated. Now you might be wondering how common this cancer is. Well, retinoblastoma is considered a rare childhood cancer. It affects approximately 1 in 15,000 to 20,000 live births worldwide. That translates to about 200 to 300 new cases each year in the United States. While it's not a common cancer, it's the most frequent type of eye cancer in children, accounting for about 2% of all childhood cancers. Retinoblastoma typically develops in children before the age of 5, with the average age of diagnosis being around 18 months. It's rare for this cancer to occur in older children or adults, although it can happen in some cases. Types of retinoblastoma. When it comes to types of retinoblastoma, we can categorize them in a few different ways. Here are the main types. Number 1. Unilateral retinoblastoma. This type affects only one eye and is the most common form, accounting for about 75% of cases. Number 2. Bilateral retinoblastoma. This type affects both eyes and is less common, occurring in about 25% of cases. Number 3. Hereditary retinoblastoma. This type of retinoblastoma is caused by a genetic mutation that can be passed down from a parent, although it may also occur as a spontaneous mutation during early development. This mutation happens in the RB1 gene, which is responsible for controlling cell growth in the retina. Children with hereditary retinoblastoma are at an increased risk of developing tumors in both eyes and may also have a higher risk of developing other types of cancers later in life. These children also have a 50% chance of passing the mutated gene to their offspring. Number 4. Non-hereditary retinoblastoma. This type occurs due to random genetic mutations in the retinal cells and is not inherited. It typically affects only one eye and does not carry the same increased risk for other cancers. Non-hereditary retinoblastoma is more common than the hereditary form and usually develops later in infancy or early childhood. Causes of retinoblastoma. At its core, retinoblastoma is caused by mutations in a gene called RB1. This gene is what's known as a tumor suppressor gene, so its job is to slow down cell division and prevent cells from growing and dividing too rapidly. When the RB1 gene is mutated or missing, the retinal cells can grow and divide uncontrollably, leading to the formation of a tumor. There are two main scenarios in which these mutations can occur. In hereditary retinoblastoma, a child is born with a mutation in one copy of the RB1 gene in all cells of their body. This mutation is often inherited from a parent, but it can also occur spontaneously very early in development. Because this mutation is present in all cells, these children are at a higher risk of developing retinoblastoma in both eyes and are also at an increased risk of developing other cancers later in life. In non-hereditary or sporadic retinoblastoma, mutations in both copies of the RB1 gene occur randomly in a single retinal cell after birth. Because this mutation only happens in one cell, it typically leads to the development of a tumor in only one eye. It's important to note that even in hereditary cases, retinoblastoma isn't always present at birth. The mutations set the stage for cancer to develop, but additional genetic changes usually need to occur before a tumor forms. This is why regular screening is crucial for children at high risk. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of retinoblastoma. One of the challenges with this cancer is that young children often can't communicate with us about vision problems, so it's up to parents and doctors to spot the signs. The most common and noticeable symptom is a white glow in the pupil of the eye, especially in dim light or in flash photographs. This is often described as looking like a cat's eye reflecting light and is medically termed leukocoria. Another common sign is a squint or a misalignment of the eyes, where one eye may turn inward or outward. This can happen if the tumor has grown large enough to affect the positioning of the eye. Some children might also develop a red, painful eye or experience a change in the color of their iris. In more advanced cases, children might have difficulty seeing or complain about vision problems. They might bump into things more often or have trouble focusing on objects. Some children might develop a protruding eye if the tumor grows very large. It's crucial to understand that these symptoms don't necessarily mean a child has retinoblastoma. Many other, less serious conditions can cause similar signs. However, any unusual appearance of a child's eye should be checked by a doctor promptly. Diagnosis of retinoblastoma. Diagnosing retinoblastoma involves a combination of physical examinations and various tests. The process usually begins when a parent or doctor notices something unusual about a child's eye. The first step is typically a thorough eye examination by an ophthalmologist, which is a doctor who specializes in eye diseases. During this exam, the doctor will dilate the child's pupils to get a clear view of the retina. They might use an instrument called an ophthalmoscope to look inside the eye. If a tumor is present, it often appears as a white or pink mass on the retina. If retinoblastoma is suspected, more detailed imaging tests are usually ordered. These might include an ultrasound of the eye, which can show the size and location of the tumor. A CT scan or MRI might also be done to get a more detailed look at the eye and to check if the cancer has spread beyond the eye. For children with a family history of retinoblastoma or those who are known to have the hereditary form, genetic testing can be done. This can help identify children at risk before tumors develop, allowing for early intervention. Treatment for retinoblastoma. The primary goal of treatment is to save the child's life. The second goal is to preserve vision if possible. In the past, the standard treatment for retinoblastoma was often to remove the affected eye, a procedure called enucleation. While this is still sometimes necessary for very advanced cases, today there are many treatment options that can often save the eye and preserve vision. One common treatment approach is chemotherapy. This involves using drugs to shrink the tumor. Chemotherapy can be given systemically, through the whole body, or locally, directly to the eye area. Local chemotherapy techniques include intra-arterial chemotherapy, where the drugs are delivered directly to the blood vessels supplying the eye, and intravitreal chemotherapy, where the drugs are injected directly into the eye. Another treatment option is cryotherapy, which involves freezing the tumor to destroy the cancer cells. This is often used for smaller tumors. Another treatment is laser therapy, specifically a technique called thermotherapy. This procedure uses heat to kill cancer cells, and for very small tumors, this may be the only treatment needed. For some other tumors, doctors might use a treatment called plaque radiotherapy. This involves placing a small disc containing radioactive material on the outside of the eye, next to the tumor, to deliver radiation directly to the cancer cells. In cases where the tumor is very large or other treatments haven't been successful, removal of the eye might be necessary. This helps prevent the spread of cancer to other parts of the body. While this might sound drastic, it's important to remember that many children adapt very well to having one eye and can lead normal, active lives. After the initial treatment, long-term follow-up is crucial. Children with retinoblastoma need regular checkups to monitor for any signs of the cancer returning or new tumors developing. For those with the hereditary form of retinoblastoma, lifelong monitoring is important as they have an increased risk of developing other types of cancer later in life. It's worth noting that the treatment of retinoblastoma has improved dramatically over the past few decades, and most of the children can be treated without removal of the eye, especially if caught early. Today, more than 95% of children with retinoblastoma in developed countries survive the disease. However, early detection is key, so it's important for parents to be aware of the signs and to have their children's eyes checked regularly. Now, we want to hear from you. Have you or someone you know ever had experience with retinoblastoma or any other eye conditions? How did early detection and treatment impact the outcome? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.